Hi, this is Sumati Christopher from Trippuram College of Nursing. Today's class, we are going to see the pediatric procedure phototherapy. So in this class, we are going to see about the definition of phototherapy, the purpose, the risk factors, and the indications, general instructions before administering phototherapy. Then we are going to discuss about the needed equipment, the procedure to follow, and the importance of documentation. Therapy. Photo means light, therapy means treatment. So phototherapy means treatment with light. According to the definition, phototherapy is the treatment for jaundice where the exposure of skin to a light source converts unconjugated bilirubin molecules into water-soluble isomers that can be excreted by the usual pathways. Blue-green light is the most effective for phototherapy as it both penetrates the skin and is absorbed by bilirubin, have the photochemical effect. Purpose of phototherapy. Mainly the phototherapy is given to bring down the serum bilirubin level to normal level. The risk factors which leads to hyperbilirubinemia are the below given conditions. Mothers with positive antibody, previously affected sibling, cephal hematoma, bruising and trauma from instrumental birth, delayed passage of meconium, prematurity, dehydration, inadequate breastfeeding, ABO incompatibility, RH incompatibility. These are all the conditions which leads to hyperbilirubinemia. Complications associated with phototherapy are skin burns due to overheating, dehydration due to water loss, diarrhea, that is a greenish frequent loose stool just because of elimination of bile, and rash and retinal damage, bronzing of neonate, that is called as bronze baby syndrome, just because of the accumulated conjugated bilirubin in the blood, and temporary lactose intolerance. The general instructions to follow while providing phototherapy are, as usual, normal hand hygiene practices to be followed. If the baby is hypothermic, discontinue phototherapy and keep the baby exposed under the fan. Once the temperature reaches normal, restart with phototherapy. Place phototherapy machine in sideways if baby is undergoing under radiant warmer. Equipments needed to provide phototherapy machine, eye shield or UV filter goggles, measuring tape and thermometer. The steps to be followed during phototherapy procedure. Initially check the bilirubin level, the SBR, that is serum bilirubin level, between 0.3 to 1 milligram per deciliter is normal. TSB, that is total serum bilirubin. If it is less than 5 milligram per deciliter, it is normal. In premature infant, more than 5 milligram of deciliter of bilirubin, they will go for phototherapy. At term babies, if the bilirubin level more than 8 milligram per deciliter, up to 20 milligram per deciliter, they will go for phototherapy. The order will be given by the neonatologist or the pediatrician. Then explain the procedure to the parents about the need for phototherapy. Check the machine for electrical safety and proper insulation of wires. Check whether all the lights in the machine are in working condition. There are two types of phototherapy machines, single surface phototherapy machines and double surface phototherapy machine. According to the bilirubin level, the doctors will suggest for which type to go for. So after checking that, adjust the height between the baby and the lamb. The ideal height should be 45 centimeters. The minimum height can be up to 15 centimeters. Place the baby without dress. Cover baby's eyes with an eye shield or UV filter goggles. Ensure eye covers are removed 4 to 6 hours gap. for eye care for feeding. Then observe the eyes for any discharges, any infection signs, damage to the retina, and document about the observations. Again, switch on the machine. During phototherapy, neonates require ongoing monitoring of temperature, respiratory rate, color of the baby skin, and color of the urine and stool. So we are just monitoring the output to ensure the hydration to the infant, and we are monitoring the weight to see whether the child is well nourished, and we are observing the total serum bilirubin level, that is the unconjugated bilirubin, and SBR levels, that is serum bilirubin level, that denotes conjugated bilirubin levels. And we are just monitoring for potential complications and signs of bilirubin encephalopathy. Change the position every 2 hours once and maintain strict intake and output chart. The nursing considerations during phototherapy: Q2H or QNH vital signs to be monitored according to the baby's condition. Ensure the Q2H feeding. Time out of light to be minimized when the bilirubin levels are higher. Turn off the phototherapy machine while taking the baby out for feeding or for some sample collections. Watch for complications. Documentation. In the documentation, the time of commencement and cessation of phototherapy. Document the hourly, type and source of light and number of lights, presence of eye protection, and the vital signs, and the general condition of the baby. Thank you. See you in the next video.